welcome back to This Week. Time now to get the views of our media and political experts, Nashville State Democratic Representative Brenda Gilmore and Syndicated conservative talk show host Steve Gill. Welcome and happy Christmas. Merry Christmas.
Thank you.
We're taping this the day before Christmas Eve because of the holiday, so this is Wednesday. Tomorrow the vote will happen in the Senate, and it looks like that 60-vote vote is going to happen, and the health care will come out. Then we'll fight over it in January, come in the House and Senate versions.
Still big differences between the House and the Senate version. It remains to be seen what they come out with in the closed-door deal-making that's going to go there. What we've seen in the closed-door deals in the House, the closed-door deals in the Senate has not been pretty. I don't think it's going to get any prettier in conference.
Well, I think that there's a lot of good things in that Senate bill. There's also some good things in the House. I hope that when they, first of all, I hope they get to 60 votes tomorrow. It looks like that's pretty done deal. I hope that happens. But when it's that close, you never can tell. So I wouldn't rejoice right yet.
You never know until the vote happens.
That's right. And when the conference comes through, I hope we will be able to preserve some of the best of both of those bills.
The President has said he is happy with what's coming out, that he got 95% of what he wanted. There's still a lot of ambiguity into what this bill is actually going to say, but the President seems at least happy that something's going to go into conference committee and eventually a health care reform bill will happen.
Well, I think that it's going to be meaningful, really meaningful to Americans. We will be insuring, of those 47 million, we're probably going to be insuring probably about 30 or 35 million people. Children will be insured immediately. Parents who have adult children, their children will be insured through 26 years of age. We will see that a wide discrepancy of the gap by how women are evaluated and men are evaluated. Oftentimes women's premiums are more expensive. That will just evaporate and go away. And of course everybody's excited about the pre-existing conditions.
That was one of the big ones.
Yes, that the insurance companies can no longer deny us because we have diabetes or you have high blood pressure or some of those other kind of diseases. So it's a lot of good stuff there.
Well, Kennedy Kassebaum years ago was supposed to have cured the pre-existing condition problem. It clearly didn't. S-chip was supposed to cover the kids. Apparently it didn't. So we've been told promises from Washington on health care for a long time. It's always cost more than they said. It's always delivered less than they promised. This bill's not going to be any different, and I'm among those who's not rejoicing. Tennessee, according to Governor Phil Bredesen, is going to see about a $1.4 billion hit thanks to Medicaid, and Brenda and the legislators are going to have to come up with a way to cut and to slice and to slash their way out of that. And Tennesseans are going to suffer because of this bill. We're going to suffer in our health care. Our seniors are going to suffer because $500 billion is being cut from care for seniors. They're going to have less doctors, less care, less life opportunities. This is a disaster for America, and hopefully Washington will come to their senses before they deliver this.
There is a huge political divide because of this bill. Republicans are saying just what Steve said, that
yes,
this is bad bill, bad law, and going to cost more. Democrats are saying just the opposite, that in fact this will lower Medicare costs and will lower the deficit. There really is hard to say how there can be such a divide.
Well, I think Democrats are asking those same tough questions, and we want to make sure it's covered. The budget office out of Washington says that it was going to be neutral, that it wasn't going to add anything to the deficit. And that's one of the things that President Obama had, one of his very important requirements, that it could not add anything to the budget. When it gets down to the state level, though, I agree that we will have to be very careful that it does not add anything to our budget figures, because right now we're already struggling to pay. We've got to get our people back to work. So I think Democrats are asking those same tough questions. Some of the assumptions that have been put forth, though, is that there is a tremendous amount of waste and abuse already in the system, and that some of that may be overcome by just reducing and minimizing the waste and the abuse.
You know, the problem is that waste, fraud, and abuse has been there. If it was easy to cut out, it would have already been cut out. It hasn't been. They're not going to cut it out in this case either. You know, the other problem is the president has said a lot. Unfortunately, none of it has been true. They're talking about wanting to make this revenue neutral, and yet the way they've gotten there is by delaying implementation of the services for about 4 or 5 years while going ahead and collecting the higher taxes, collecting the revenue, so that in the first 10 years it looks close to revenue neutral if you get all that savings from waste, fraud, and abuse. The second 10 years, when you've got full services, full revenue in there, It busts the budget to the tune of trillions of dollars. It is financial shenanigans to make it look good. It doesn't meet what the president said he wanted, and it doesn't cover that many more people. His own Health and Human Services Department a week ago said that this will cost us more than doing nothing. That's Obama's Health and Services Department. So this is all a fraud. It's all a sham, and it's all built on the president trying to get something to be able to talk about at the State of the Union address, not to improve America's health care.
Well, you know, all of the experts, including people in the insurance industry, has said even if we do nothing at all, if we sit on our hands and do nothing at all, our premiums are going to continue to skyrocket. We see that the insurance companies now are making billions of dollars in profit. And for us to have a rich country like we have and to allow people to die, I think it's been estimated something like 47,000 people a year die just because they don't have insurance. Not because they're underinsured, just because they don't. Then I certainly think it speaks to America and our morals, and that we should do something to address this.
Then why do we delay the implementation of this for 4 or 5 years? If 47,000 people are dying a year, what we're saying is President Obama and the Democrats want to kill off another 250,000 people rather than implement it now because it costs too much.
Well,
y'all are killing people.
I think, no, we aren't killing people, but I think the system is killing.
So why delay the change?
We are allowing people to die. It's a very complex issue. It's very complicated, and we can't give all the answers. And this bill certainly is not perfect.
Right.
I'm sure that when Social Security was implemented, that everything was not in that bill that those presidents wanted.
And it was also supposed to cost less than it has. It's going bankrupt. Medicare's going bankrupt. Medicaid's going bankrupt.
But the question I would put forth, though, is we've been talking about insurance and reforms for the last 100 years, and no one has done anything.
This is the first effort.
Everyone admits that something should have been done and something can be done, but we aren't willing to make those sacrifices.
The other wrong thing is not the right answer.
Politics is politics. Deals are cut all the time on all pieces of legislation, but a lot of questions are being asked about this particular piece of legislation, and that Nebraska effectively got opted out of the Medicare costs. Tennessee's Lieutenant Governor and several lawmakers are saying, hey, if they can do it, we should opt out too. Right. This is going to cause an issue.
I agree, and certainly Senator Nelson, I think, went too far in the negotiations. We know that our legislators, both congressmen as well as our senators, they negotiate and they try to bring as much pork back to the states as they can.
That's their job.
And as citizens, we appreciate that because we have projects. But in the end, taxpayers end up getting holding the bag and paying for it. And I really think that Senator Nelson did go too far, that he went beyond the line of negotiation in good faith. And so I would like to see that when they go back into the conference, that particular issue would be relooked at and rethought.
If this is such a good bill, why does Nebraska need to be excluded? If it's such a good bill, why do members of Congress and the Senate have to be exempted from it? If it's such a good bill, why can't they tell the truth about what it's going to cost and how they're implementing it and all the fraud and all the backroom dealings? Why didn't they negotiate it on TV, on C-SPAN, like President Obama promised when he was a candidate? Why'd they go into the back rooms? If it's such a good deal, why are they having to be so dishonest about it?
30 seconds to go. As it looked like once the thing passes, it looks like if it does pass, that state lawmakers like yourself are really going to have to watch how much comes down to state level.
We are, and we're just going to have to be very, very careful that we don't end up taxing our citizens. You know, I will admit that. And although it's a balancing act, we need insurance. There are plenty of Tennesseans who don't have insurance. They end up in the hospital sometime for emergency care that had they had insurance, they would not have to go on that route. Or some even end up dying. You know, I had a call from a constituent who's just been cut from TennCare, who's a cancer patient, and she has no way to have a chemotherapy. To me, in America, we should be able to help people like
Brenda
that.
Gilmore, Steve Gill, appreciate your insights. Stay with us. This week continues in a moment.